All right. Hello, everyone. I wrote my manuscript on the use of heart rate variability as a tool for monitoring treatment for anxiety disorders. Why this topic? I chose this topic because anxiety is a huge problem in the US. I don't think it's treated very effectively, and I personally have a history of anxiety. I learned that my Apple Watch can track and record heart rate variability, and that this is activated by using the breathing app, and you can do it as short as even 1 minute sessions. By using the breathing app along with meditation, I was able to increase my HRV and was able to wean myself off of antidepressants. The journal I chose was Activities, Adaptation, and Aging. I picked it because it met the criteria for our project. It's an APA formatted publication. It includes topics related to the thesis of my manuscripts, and it has a good acceptance rates for EBP articles. The search. I searched for my articles using PubMed. Keywords were heart rate variability and anxiety. Articles were written within the past 10 years, and they were peer-reviewed articles. This returned a lot, and I had trouble refining my search criteria. So instead, I developed extensive exclusion criteria that includes children, depression, postpartum, PTSD, cancer, and alcohol abuse. From the remaining list of articles, I chose 3. The first study looked at the relationship between HRV and mindfulness in the setting of anxiety. It was published in Behavior Research and Therapy in 2013. It was an observational study that used regression analysis, which is known to be a little bit imprecise of a tool, even if it's statistically significant. Despite that, the data clearly showed a 200% increase in HRV times for anxiety patients pre and post mindfulness practice. I thought it was a great article, but was a little curious to learn that it only measured the parasympathetic side of the stimulation in the autonomic nervous system and not the sympathetic. The second study looked at the use of HRV biofeedback tools as a treatment for anxiety symptoms in older adults. It was published in Aging and Mental Health in 2018 and was a cross-sectional study. The study used a phone app that measured HRV in order to provide feedback on effective mindfulness, and it found that it reduced subjective anxiety in the older adult population. It was a small study done over a short time, but it was non-pharmacologic, it showed good efficacy, and was able to produce results within a 3-week period. The third study looked at HRV and its association with anxiety. It was a large cohort study with a patient population of over 15,000 people. It was published in the American Journal of Psychiatry in 2014. There are a lot of co-founders when looking at anxiety and HRV, and this study used propensity score weighting to control for these confounding variables. The study found that even when considering for co-founders, that there is clearly an association between anxiety and HRV, and that people who have anxiety have lower HRV. It also found that the use of antidepressants lower HRV, which questions if these medications improve mortality related to their anxiety or if they only treat the symptoms of anxiety. The conclusion of this research is that there is an association between anxiety and heart rate variability. The study shows that HRV is lower in people who have anxiety. It also shows that low HRV is associated with higher morbidity and increased mortality. Mindfulness and meditation can increase heart rate variability and reduce subjective anxiety. The implication to nursing is that this information can be shared with patients and colleagues about a low-cost, non-invasive tool for measuring anxiety treatment. It can be done in the hospital, in the clinic, or at home. A clinician or a patient can measure it, and that data can be useful in monitoring and adjusting home therapies such as meditation in the non-pharmacologic treatment of anxiety. Thank you very much.
What do you think?